So what we're here for today is to basically give you just a bit of a taste of what the programs are like in DGSI, the Durham Global Security Institute, which is here at Durham University. I'm going to present to you from a course. The course code is called SGIA 43715. You don't need to know that. It's about humanitarian assistance to war-affected areas. So I'm going to tell you a little bit about the program. I'm going to give you some I'm going to be pretty light on the heavy theoretical stuff because we can save that for the actual classroom. But try to give you a taste of what a module like this is really trying to teach, and how it fits into the broader degree program, so that you can help make a decision if these programs are right for you. This course, as I mentioned, it's called Humanitarian Assistance to War-Affected Areas. It's just to introduce myself. My name is Dr. Will Plowright. I'm an assistant professor in international security here at Durham University. I've been at Durham for about 2 years now, and before that, I spent about 12 years working in the humanitarian sector as an aid worker. I worked mainly for an organization called Médecins Sans Frontières, Doctors Without Borders, where I worked in Afghanistan, Syria, Iraq, Yemen, Libya, Bangladesh, a number of other places. So this course, what I'm really trying to do is to take that sort of dense theoretical academic stuff that we're all here to learn about in university, but to really match it to real world scenarios and real world experiences, by bringing in professional humanitarians into the classroom, but also sharing my personal experiences with you. As I already mentioned, this is part of the Durham Global Security Institute, or DGSI, and it's part of the two masters that we offer. The first being Defense Development and Diplomacy, and the second being Conflict Prevention and Peace Building. So what are we going to talk about today? Just very broadly. As I mentioned, our sample lecture, I'm going to introduce you to the theoretical ideas behind humanitarian assistance in conflict and disaster-affected areas. We'll talk a little bit about the principles that humanitarian aid workers use in order to guide their assistance and to make complex decisions in really ethically murky and challenging situations where they have to make really tough calls about which conflicts to intervene in, Ukraine or Gaza, which neighborhood to intervene in. Because if you decide to build a hospital in one neighborhood, that means you're not building it in another. You distribute food in one community, that means you're not feeding another. But even when you start running your programs, humanitarians have very tough decisions to make about staff safety, for example. But how much risk is it acceptable for your staff to accept while trying to deliver assistance in a conflict zone? Talk a little bit about the risks they face and those ethical dilemmas. Firstly, just to clarify for everybody, for this lecture, or this sample lecture, but also for the module in general, we're talking about really tough subject matter. It's impossible to talk about humanitarian assistance without talking about human suffering. I'm not going to show you any pictures or videos that are inherently distressing. I'm not going to show people who are sick, injured, dead, or dying. But again, we remember that there really are human beings behind this subject matter, and it's impossible to talk about humanitarian assistance without talking about violence, about armed conflict, things like that. The module aims, and I'll go through this quickly because this is the formal stuff, the formal objectives of this module. Firstly, to explain conflict sensitivity and how a conflict-sensitive approach to humanitarian and development interventions helps to minimize the negative impacts and maximize the positive impacts of such outcomes. To be able to identify key decision makers, leaders, potential spoilers, and beneficiaries, to understand how a conflict environment impacts on decision making, and the implementation of relief and development projects and programs. And lastly, to be able to design approaches that reduce the risk of an intervention sparking or supporting violence by identifying flashpoints. So what do we actually do in the module? The module, as I mentioned already, is drawn from a lot of my personal experience. It usually takes place over a period of about 3 days, 3 full days. We have some lectures from myself, but I also bring in some former colleagues of mine from the humanitarian sector. We do group work exercises where we break the class up into smaller groups, and I give you real world problem sets that are based on either my personal experiences or those of my colleagues, and then encourage you to think through the theoretical side of things, the theoretical readings we've done, but then push you to actually design a policy response, to make a decision about what you would do in a tough situation from real world challenges that humanitarians face in places like Afghanistan or in Gaza. And that will all build up to one main tabletop exercise where you effectively role play as members of an organization to develop a strategy, a policy strategy. Now, when we talk about all these things, we're talking about humanitarian aid, we're talking about security challenges. I thought I'd kind of frame the discussion by starting with what is something very much in the news at the moment. That is, of course, the situation in Gaza. Um, I'm not going to try to summarize the long history of the situation in Gaza, but as we all know, there's extensive needs on the ground, medical, food, water. The situation has been worsening for months. It will continue to worsen. There's a risk of spreading disease like cholera breaking out, very high rates of severe acute malnutrition. But humanitarians on the ground there face pretty much every challenge that humanitarians face in any conflict anywhere. They face active blockades, effectively sieges that they have to try to negotiate their way through, where armed forces physically preventing food, medicine, even surgical supplies, things like that, which means that you have new problems, things like war wounded. You have large numbers of men, women, and children who are war wounded, but it also exacerbates pre-existing health needs. One of the most common of those is women need a safe place to give birth. When hospitals are destroyed, when clinics are destroyed, and when they are then not supplied or blockaded, that then means that the mortality rate for birth can really skyrocket, which is tragic. So humanitarians are facing blockades to their assistance, but they're also facing a lot of direct attacks. There have been at least 8 strikes on known aid facilities, as well as multiple humanitarian convoys being struck. Convoys of vehicle transporting humanitarian supplies, humanitarian staff, and at times patients and beneficiaries. These are convoys that they're not traveling in secret. They're clearly identifiable from the ground and from the air, with big logos on the roof and flags waving on the side, and yet they've still been attacked. According to the United Nations, at least 224, that is an astonishing number, 224 aid workers have been killed in Gaza, which is the most of any conflict. The situation for humanitarians there is extraordinarily difficult. Naturally, much worse for the civilian population themselves, but the humanitarians face a very high barrier and immense challenges in trying to deliver assistance there. Share with you one image. This image is a message that was written on a patient board. There's a spelling mistake in the slide there, I apologize for that. But this was left on a patient board, which is a standard thing you see in any ward of a hospital, just listing the patients that are in that ward at the moment. It's written by Dr. Mahmoud Abu Najili at Al-Aud Hospital. And he basically wrote, whoever stays until the end will tell the story of what we could, or, excuse me, whoever stays until the end will tell the story, we did what we could. Remember us. Within a day of him writing that message, that hospital was struck by an airstrike, which is, of course, a violation of international humanitarian law. This is that same message board after the hospital was destroyed. I'm showing you this to kind of make that point of the risks that they face, even in doing things like delivering medical assistance. These were staff from the organization Doctors Without Borders who were killed in that airstrike. So those, I've kind of set things up in mentioning one of the worst situations that humanitarians or aid workers can face. But what are we really talking about when we talk about humanitarians? In our kind of like everyday understanding, a humanitarian has a fairly straightforward meaning. It's basically someone who does nice things, a benefactor, a philanthropist, something like that. Under international humanitarian law, however, the humanitarian is actually something a bit more specific. It's a civilian who engages in providing assistance in times of suffering and distress. One common definition is it's the independent, neutral, and impartial provision of relief to victims of conflict and natural disaster. The general distinction is that it's about providing support and compassion in emergency, not about strategy, power, or profit. The reason that's an important part of the definition is because you have probably heard of your own government and many other governments constantly talking about their plans to offer humanitarian assistance or humanitarian relief. But when they do so, they do it to achieve their own policies. For example, when a Western power invades a non-Western power and destabilizes the government, as we saw in Afghanistan or Iraq, the invading forces will use a lot of rhetoric about how they're providing humanitarian assistance. but they don't do it according to these three principles that I've put in bold and italics in the definition: independent, neutral, and impartial. Independent means that the people delivering the assistance are not taking orders from someone else. So I'm from Canada. If the Canadian Army is distributing food, it's not technically humanitarian under IHL, International Humanitarian Law, because they're taking their orders from the Canadian government, from the Canadian military. Neutral means not picking sides. It means if I am a humanitarian worker and I go to Yemen, I do not decide which of the warring parties I think is the right side or the just side. I treat them all the same way because my goal as humanitarian is to access the civilian population in need of assistance. And thirdly, impartiality. That means we deliver humanitarian assistance based on need and no other characteristic. Not their political affiliation, not their religion, not their gender, not their sexual orientation, not their ethnicity, their race, their creed. No reason other than medical need. Or I should say humanitarian need. Sorry, I said medical need because I used to work for a medical organization. When we say humanitarianism, we're talking about something different than international development. International development is what happens in the long term. We can imagine a basic way to distinguish humanitarian assistance from international development is humanitarian assistance is treating the suffering that is here and now. It's addressing the symptoms of these major problems, crises like those in the Democratic Republic of Congo or Sudan, but it's not trying to solve the situation. It's treating the people who are alive and suffering or facing death. International development, on the other hand, is long-term. It's not trying to provide relief in the short term. It's trying to build stability in the long term. Oops, I see someone's waiting in the room. I'll let them in. Secondly, as I mentioned, humanitarian assistance is different from foreign aid. That's what governments do. It's also different from volunteering. That's what non-professionals do. Humanitarian aid workers are professionals. They're people who are trained, prepared, and employed by their organizations. If you ever want some reading on the subject, on the right of the slide are two books that I think are really interesting ones. They were really formative in helping to shape my views and my opinions. The top one, An Imperfect Offering by James Orbinski. He received the Nobel Peace Prize on behalf of Doctors Without Borders. And this is basically a biography. The second, A Bed for the Night, Humanitarianism in Crisis, is a book that talks about how humanitarian assistance has changed over time, especially looking at the situation in the 90s when the United Nations became more active in conflicts around the world, and in the 2000s when, of course, the Iraq War and the Afghanistan War began. As I kind of mentioned at the outset, when humanitarians are working in these types of places, they've got a lot of extremely difficult decisions to make. Who should get assistance, right? Sometimes that's a very broad question. Which part of the country should we try to deliver assistance in? Maybe the country we're talking about is a place like Myanmar, where the government really tries to prevent humanitarians from delivering assistance and will only give them access to very specific areas, like, let's say, the capital, Yangon. Some humanitarian organizations make the decision, well, we can't go to the areas of greatest need, so we'll do what we can, which is to provide assistance in these specific areas. But even once you decide that area, who then should you target with your assistance? Because no organization can do everything. Maybe you look at the situation and say, the greatest needs here are food related, we need to distribute food. Maybe they look at the situation and say, actually, the health needs are extremely high. We need more clinics, we need hospitals. Maybe there's an outbreak at the time, be it diphtheria, cholera, Ebola, even COVID. These questions of who gets assistance is a really, really tough question to answer. And as I mentioned already, whether it's in the very broad lens of which conflict, or even more locally, rural areas versus urban areas, what level of risk is appropriate? Is it morally acceptable for organizations like Oxfam, Save the Children, the Red Cross? Is it morally acceptable for them to put their staff in harm's way? And at what point is the danger so high that you can't continue to operate? At some point, there is going to be a level of risk that's too high to drive around distributing food, for example. But knowing exactly where that is not a simple or straightforward task. Another challenge is, what about all the violent actors in the area? if you are working in, say, Syria in 2014, you're dealing with a lot of different warring parties who probably don't have very high levels of respect for international humanitarian law, human rights law, things like that, be it the Syrian government, be it an armed group like the Islamic State. Some humanitarian organizations will essentially negotiate with those armed actors to get access to the civilian population in those areas. But that, of course, can create high risks. Because being in the neighborhood with extremely violent actors, of course, brings a risk that the conflict can escalate and that staff can be caught up in the crossfire. Or that when humanitarian operations are set up, that it will draw more civilians into a certain area and that they will experience a higher level of a risk or of danger. These are extremely tough decisions to make. I've mentioned the organization I worked for, MSF. I'll just put all this down. Quickly, this is a slide that I'm showing you that's actually from an exercise that we would do in class where we kind of get to know each organization. These are just four of the most prominent: the International Committee of the Red Cross and Red Crescent, or the ICRC, Médecins Sans Frontières, Doctors Without Borders, Oxfam, and Action Against Hunger, or also known by its French name, Action contre la faim. Each organization has its own culture. Each organization has its own area of priority. Médecins Sans Frontières, MSF, of course, is medically oriented. The ICRC are seen as the keepers of the protectors of international humanitarian law and the keepers of the Geneva Protocol. So lots of their work is in that. Oxfam often does lots of things related to food and water, and Action Against Hunger, of course, largely does work around nutrition and food availability and food security. When we're in class, we'll role play a little bit as these different organizations, so that we can start to learn the differences between them, but also so that we can I'll encourage you to start making policy decisions about how you would recommend each organization navigate these really complex scenarios like the ones we've discussed in Gaza or elsewhere. We'll also talk quite a bit about ethical dilemmas. Now, for our purposes today, I'm not going to go too much into the really theory-heavy stuff, but oops, that takes the funny order. But basically, an ethical dilemma is anytime we've got two principles weighed against each other, where we have potential negative outcomes with both decisions. For humanitarians, it's when those humanitarian principles I mentioned come into conflict: neutrality, impartiality, and independence. Anytime we have a situation where there's a question which principle is more important, that creates an ethical dilemma. And humanitarianism is a constant world of ethical dilemmas. Every single day, staff at every single level are always making these really, really tough decisions. The definition of ethical dilemma for those interested in the more theory side of things: situations in which each possible course of action breaches some otherwise binding moral principle. So let me give you we're gonna go into some more detailed examples, but I'll just give you one or two really, really quick ethical dilemmas right away. Let's say that you're in charge of an organization that is working in Afghanistan right now. Afghanistan, of course, controlled by the Taliban. Taliban comes to you and says, it's really nice that you want to run this hospital for the displaced people in this area, but we're not comfortable with you employing any women. So if you want to run this hospital, you cannot hire a single woman and you can only hire men. You then have to make the tough decision about whether or not you think that's acceptable. Should you accept to only hire men and trade away a lot of your beliefs and principles about gender equality? Also trade away a little bit of the quality of care, because sometimes, very often, not just sometimes, very often, female patients need female healthcare givers. Should you trade that away because it's better that we do something than nothing? Or do you decide that that situation is unacceptable and you're going to leave? But that then means no hospital, nobody gets assistance. These ethical dilemmas are super, super tough. I'm going to give you a couple samples that I'll discuss a little bit more in detail that we'd discuss in class. And these ones are actually drawn from my personal experience, and also from some famous historical examples as well. But this first one is one I faced when I was working in a place called Bossangoa, which is in the Central African Republic. If you're not familiar with the Central African Republic, also known as CAR, it is ranked near the bottom in most indicators of development. Health, education, levels of poverty, food insecurity, reliance on humanitarian assistance. It's a place that has a number of endemic diseases, has almost no healthcare infrastructure. It's been ravaged by civil war for many years now. It's an extremely difficult context to work in with a very large population in need. I don't want to bombard you with too many facts um, about about CAR in specific, but at the very basic, there is a group of local militia called the Anti-Balaka, who are mostly Christian, and the ex-Selika, who are mostly Muslim. I don't want to simplify things as Christians versus Muslims. That's the dynamic I'm going to focus on a little bit. The real conflict is much more complex than that. But for the purposes of a single slide, that's how I'll frame things. So you're working in CAR, you're working in a hospital in an area held by the Christian militia, the Anti-Balaka. Your staff come to you and tell you about a woman from a nomadic Muslim minority who needs to come to the hospital. It sounds like she's in critical condition. She needs medical attention immediately, as quickly as possible. However, the Christian militia that control the town, the Anti-Balaka, have told you they do not want any of that minority in the town. They've threatened those people with violence in the past, and they've also entered the hospital and violently removed people from that minority and dragged them out of the hospital, and they were probably killed. Oh, there's a map of CAR that came a bit later, then might have been helpful. So the question I would then put to you, and that we would discuss in workshop in class, what is the right thing to do in this scenario? Should you tell the woman to leave? Basically just send her the message that she shouldn't come to your hospital. She might be from a persecuted minority, but it's too dangerous. You can't help her. Do you go to the militia? Picture of them on the right, the Anti-Balaka. Do you say, no, I am here as a humanitarian aid worker, as a representative of the international community, and I demand to you that you allow this woman into the town, that you leave her alone, and you let us treat her, provide her the medical assistance that she desperately needs? Or do you hide the woman? Do you basically just not tell the militia and hope they don't notice? Send a car out to get her, bring her quietly into the town, maybe in the evening when hope people aren't paying attention, get her the treatment she needs in a quiet part of the hospital, and then hopefully quickly and quietly send her on her way. Or do you take the most drastic option and say, this is simply too high of a level of insecurity, too high of a level of violence. The risk to our staff is simply too high, and we can't operate in this scenario, in this situation. In class, we would discuss and debate, and I'd encourage everyone to actually pick which option they would do if it was them in this situation. And we try to defend our answers, of course, by referencing our theoretical readings and everything we've learned. Because when it comes to what is the right answer, there isn't really a right answer, right? That's what makes these ethical dilemmas so tough, is that you don't really get to find out afterwards if you've made exactly the correct decision. Humanitarian workers have to make these decisions very often with limited information, and make these decisions quickly, just in order to stay active and try to treat people in need. In practice, this is a situation that I faced, and in the real world, what we did was we did option number 3. We sent a quiet car out in the evening. We picked up a woman on the outskirts of town. We brought her in. We got her the medical attention we needed. The next day, I got a phone call from the militia saying, Mr. Plowright, we're very aware of what you did. Make sure you don't do it again, because if you do it again, there will be very bad results. And I apologize for the confusion, went to some meetings, tried to rebuild a working relationship so that they'd leave us alone. And things were mostly okay from there. Maybe we got lucky on that one. It's hard to say. In a situation like this is actually a picture of the hospital in Boston Go. The many things we're trying to balance here in making this decision, this ethical dilemma, is the first is, of course, the well-being of the woman herself. As humanitarian aid workers, of course, they want to be able to provide assistance to a persecuted minority who needs it the most. But they've also got to maintain relationships with the armed groups that control the area, the militia, Because if that militia one day decides they don't want the humanitarians there, the humanitarians there are not going to be there for very long, right? And an area controlled by an armed group, if that armed group doesn't want you there, you will be out very, very quickly. If not violently, even with just the threats of violence, it's enough to compel humanitarian organizations to withdraw. But there's the safety of the staff, the well-being of the woman, there's the presence in the area, but also just the functioning of the hospital. It's a hospital. There's many patients. And if the hospital closes, that's many people who will not get medical care that they desperately need. So you have to weigh all these competing things together. Here's another example, which is a bit more of a historical one. This is not from my personal experience, but it's a very famous dilemma from the humanitarian sector. I'm going to go back in time a little bit to probably before most of our students were born, when I was still in secondary school. We're going to look at the Great Lakes refugee crisis in Central Africa, 1994 to 95. At that time, as you probably know, in 1994, there was a really horrendous genocide in Rwanda. Hundreds of thousands of people killed in a matter of months. Without trying to give you a complex history of that genocide, towards the end of the genocide, the former government of Rwanda, who were themselves participants in the genocide, they fled to neighboring Congo. And with them, they encouraged a very large displacement of refugees from Rwanda to Zaire, what is now called the Democratic Republic of Congo, DRC. The Rwandan government basically spread the idea that people should flee because there would be a revenge genocide. We don't need to get into that too much. The important thing for now is just to know that, imagine we're working with humanitarian organizations in a town called Goma, which is just across the border in what was then Zaire from Rwanda. Suddenly, a couple of million refugees arrive. At the time, it was the largest and fastest exodus in human history. At the peak of that crisis in 1994, about 20,000 new refugees were arriving every hour. Goma had been a really small town before these events, just a small, sleepy lakeside town near the border, but suddenly it became many, many, many times larger. Of course, with no healthcare, no infrastructure, no sources of safe water and food, or places to water and sanitation, latrines, toilets, things like that, that means disease will be rampant. Will spread very quickly, especially amongst a displaced population who are already suffering various health needs. So there were, as a spike in cholera cases, there was meningitis outbreaks, malnutrition, of course, dysentery. Here's the ethical dilemma that humanitarian organizations faced. And this was a dilemma famously faced by MSF, by Doctors Without Borders. So we have this very, very large displaced population. But inside that population are the militia, known as the Interahamwe, who committed the genocide in Rwanda, right? So we have lots of innocent displaced refugees, but also hiding amongst them are a large group of extremely violent people, up to 70,000 of them, in fact. They have started widespread violence in the camp, including executions, torture, sexual assault, but also theft of aid and aid supplies. They've gone charging into the facilities of humanitarian organizations, demanded their supplies, taken their radios, their cars, demanded cash, also taken their members to healthcare facilities and demanded preferential treatment, and lots of widespread violence against NGO staff. So organizations like MSF are forced to make this decision. And again, as I said, this is the sort of thing we'd role play in class. So what decision should they make? Do they basically continue? Do they say this is the biggest humanitarian crisis in the world? There are between 1 and 2 million displaced people here with desperate needs. Maybe they cut a deal with the armed groups. Maybe they try to bribe them. Maybe they say, okay, take these vehicles or take this cash or take those radios, but then leave us alone. Do they call in for military protection? Some people might say that, hey, they could call in the United Nations, ask them for help. They could call, at the time, France was considering a military intervention. On the face of it, that might sound like an easy solution. The problem is that military solutions to problems often include violence. And violence when violence starts to spread amongst a very large displaced people, 1 to 2 million in this case, that means a lot of people are going to end up implicated in that violence, a lot of innocent people. So if you call for that intervention, that means in some way you're complicit in the results of that intervention, which might not go well and may involve a lot of innocent civilians being caught up in the crossfire. Fourth option, of course, is to withdraw completely, to say this has gone too far. We cannot work in this situation. This has reached that point where the violence is too high, our staff can't operate safely, and we can't be sure the aid we give is actually going to help people in need, so we're going to leave. If you're curious about what happened in the real world, in this case, MSF France, they took the fourth option. They withdrew. Even though it was one of the worst humanitarian crises at the time, they said the situation of insecurity is simply too high. We cannot work here. So in conclusion, just drawing together the things we've talked about, and this will be the end of the sort of sample lecture for now. These dilemmas are, of course, extremely difficult to make in practice. The goal of this module, though, is to really help you understand how these decisions are made, right? Firstly, what are the operational challenges of humanitarian organizations in these types of settings? How do they make these decisions about risk? When can they decide that the situation is too dangerous? What is that relationship to their staff safety? Should they continue operating when some of their staff have been injured or killed? And most importantly of all, who decides? Most international humanitarian organizations are headquartered in the West, but most people who work for humanitarian organizations are people from the global South working in their home countries. So when decision makers in Geneva, in Amsterdam, in Brussels make decisions on the ground, largely they're making decisions for Congolese people working in Congo, South Sudanese people working in South Sudan, for those local staff working in their own areas. Not everyone is, of course, vulnerable to the same risks in the same ways. That is the little, stop sharing for now. That is the little taster to this module. I hope it helped give you some insight on what we'd be doing in the module. I think we try to make sure this is a very fun and dynamic module, but I can also say that I know for sure that it's the same for the DGSI courses in general. We've got a really interesting sort of portfolio of modules that include other things. There's one of the ones I teach is a field trip module where we actually leave the UK and go to a post-conflict environment to learn about the place directly. We do our capstone humanitarian simulation, which is a gigantic role play of a humanitarian crisis that takes place over several days. But we've got experts and people who are more used to working with ministries of defense and still have strong connections with ministries of defense. So they're able to teach their courses by bringing in real professionals into the room in a way that is pedagogically rewarding, but is also interesting and at times even fun. I'll leave things there for now. If there are any questions, I'm happy to answer them. But if not, then thanks very much. And I hope to see you at DGSI next year. Thanks very much.